The Pan American Health Organization is observing the 8th anniversary of Vaccination Week of the Americas. Originally launched in 2003, Vaccination Week in the Americas is an annual hemispheric event endorsed by the Directing Council of the Pan American Health Organization. Dominica will join hands with other countries in this region to make this campaign a success. This year's Vaccination Week of the Americas, scheduled to take place between April 24th and May 1st. This year's theme, Reaching Everyone, reflects the importance that the Ministry of Health has placed over the past 28 years on the prevention of diseases for all Dominicans, particularly among our children. Efforts will focus on reaching everyone, especially our immigrant population, as well as Dominicans who have not been immunized, particularly against tetanus. Immunization against hepatitis B will continue, as this year we focus on our 14 to 18-year-olds. Dominica continues to report immunization coverage of the target population of 95% and over for all vaccines offered under the expanded program on immunization. Our children have received protection from common diseases affecting many of their counterparts in other parts of the world. Measles has been eliminated in the Americas, with the last case reported in 2002. Polio was also eradicated in the region in 1994, and the last case of endemic rubella was reported in 2009. We in Dominica have not seen a case of any of these diseases since the early 1980s. Diseases such as diphtheria and pertussis have also not been reported. The last reported case was in the early 80s. It is clear that the use of vaccines by the Ministry of Health is one of the major factors in disease prevention. Parents can testify to a greater quality of life for their young children, and resources can now be redirected to other public health interventions to combat chronic diseases such as diabetes mellitus, hypertension, and cancer. Despite such successes in immunization, there continues to be some communities where our children have not completed their vaccination schedules. These children continue to be at risk of contracting vaccine-preventable diseases. We have also experienced an increase in the number of cases of tetanus in our adult population who were not immunized. This disease is preventable through immunization. The bacteria are prevalent in the soil and can be contracted easily through a break in the skin. It is with this in mind that the Ministry of Health is encouraging all persons who have not received the tetanus vaccine to report to their health centers and get immunized. An appeal is particularly being made to the Haitian community in our midst to visit the health centers nearest to them to be immunized. Government continues to provide the vaccines free of cost to its citizens. Vaccines are expensive, and so we must embrace the opportunity and get immunized. This year, the seasonal influenza vaccine will be introduced free to persons who are at high risk for developing complications from seasonal influenza virus. Finally, as Minister of Health, I wish to congratulate the community health workers who execute the expanded immunization program. They continue to play a pivotal role in our country's achievement of 95% immunization coverage. Additionally, the Ministry will recognize the most outstanding health team in terms of promotion, coverage, and outreach within their respective health districts. There is still much to be done. I therefore urge all Dominicans to continue giving support to the Ministry of Health in these important health activities. Your participation in the immunization program is vital and necessary for you and your children. Vaccination is an act of love for our people. We must love them, we must protect them, and hence we must immunize them. I thank you.